multiculturalp.com. As often has been the case, we want subject matter experts to be able to provide insight, details on where and how we should approach our health, the important facts versus these lies and things that are literally destroying how we approach our health. Tonight, I have gathered, and at least they have elected to join me. I don't know why, but at any rate, here at Rolling Out, we just want to make sure that our community meets subject matter experts that really have their best interests at heart, and they're healing and actually eliminating health disparities, and in this case, information disparities that exist, propaganda that exists, that is really confusing the public as it relates to testing, how to approach COVID, and distinguishing truth from the lies that fill our community. So thanks, guests, for coming tonight. And I will start with the famous APR Executive Multicultural Communications, Vickie Gogo. Thank you so much for joining me. And then the professor from my alma mater, of course, it is Mikki K, that is with a K, as in cool, Harris, the professor of journalism and communications, and then, of course, my brother and a phenomenal physician who has done an impeccable job at making testing accessible from around the country. Dr. Kimes, thank you so much to all of you for joining me. How are you this evening?
Excellent, excellent.
Question, and we'll start with you. How can we tell the difference between fake news and real news? Ms. Gogo, we'll start with you.
Sure, thank you first, for having me here tonight. I am very pleased to be here and share this information and talk about this important topic. I think people can really start to just educate themselves on what is news, right? So understand the difference between news and opinion. And I think that's one of the biggest things to start with, and being able to look at sources that they get through social media, through news outlets that they've heard of and some that they haven't heard of, and really investigate and see what then makes sense to them. You know, kind of some things your mom always taught you, if it seems too good to be true, it probably is. You know, so anything that's on the extreme on one end or the other probably isn't true. There may be something in the middle that speaks to some truth, but if it seems too good to be true, it's probably not true. You know, I always tell people, a lot of my family members and friends, you know, check your sources. I started out as a journalist in this field 20 something years ago, and check your sources, you know, look and see the authors. Have they written other articles? Have they, you know, do they write for a reputable source that you've seen or heard of? If it's a news outlet that just popped up yesterday, you know, question it a little bit more heavily.
Well, I thank you for that. Same question, Professor Harris.
Thank you. It's good to be here. When we go online, you can easily see what's trending. And what's really important to know is information that's trending doesn't necessarily mean it's factual, it's truth. It just means a lot of people are looking at it. So as Dr. Gogo said, think about sources and understanding the source, and also what the motivation is behind the source in putting that information out. Is it to help? Is it to draw a sense of emotion? Is it to instill fear? Questioning the source and also the intent of the source is really important.
Same question, Dr. Kimes, and I know you have a great, phenomenal perspective.
So for physicians in particular, you have to look at multiple sources. So I usually try to look at least 3 different journals. If it's one journal that's putting out the information, I look at all the references and I try to read the references as well. In terms of news, I think you always have to look at least 3 sources. So you want to look at the subject matter. The beautiful thing is we have Google right now, and we can almost access anything via Google. So I look up stuff and I try to read at least 3 articles. And then there's reputation. If you know that there's a news outlet or a particular person in the news outlet that typically seems to run information that is, you know, for political purposes or for other purposes, you already know people don't tend to change. If someone shows you who they are, like we know the famous saying, then you can believe them. So, try to stick with people who you consider reputable because of multiple experiences if you can.
Doc, you're really nice and light. I met more new doctors, this doctor from China, and this, we had the whole, I was afraid to pick up my cell phone if I'd have listened to this 5G technology. Why do these fake news creators exist, in your opinion, Ms. Gogo?
Because it's easy. Everybody wants to have a show like you have a show. They want thousands and millions of followers. They want to be famous. And it's easy now. We all have, working from home or working from other locations. We all have a smartphone. It's easy to make yourself famous and recreate yourself. Last week, you may have been working in the grocery store, but at 6 o'clock in the evening, all of a sudden, I have a white jacket. I'm stitch my name right here. I'm going to become whoever I want to be and start telling everybody, and it gets shared. So it's really easy for that to happen, and it's really easy to change my background, and all of a sudden I've got scholarly books and all that on my bookcases behind me. Nobody will know. And so you can reinvent yourself. People will create new profiles on social media. They'll create just whole new personas and connect to people that you and I think, oh, well, that person's reputable. Oh, well, they know this person. Oh, well, it looks like they've connected to everybody at this or that university. It must be true. And so it really takes it makes the individual just work that much harder to really discern truthful information from truthful sources.
So for you, Professor Harris, what is the most shocking, glaring fake news that you've experienced related to COVID?
I'd say it was when we first started and hearing about COVID, and it was Black people can't get COVID. So it's nothing that we need to worry about or be concerned about. We wash our hands, we're going to look out for each other, but this isn't something that's going to affect us.
Just following up, Dr. Kimes, following Professor Harris, how did that impact us? Once we got fake news, people began to spread it. How have you found that this has impacted what you do?
I think that it's caused multiple deaths. I remember patients would come to me and say, I really don't think Black people get this. And, we didn't really know in the beginning, but I told people that I would always err on the side of caution. Turns out this is a Black disease. The deaths, of course, there's lots of people that are infected. We're 6 million plus right now in the US, but, in terms of the 184,000 people, we still represent 40% of the deaths. We only make up 13% of the 330 million people in America. So this is a Black disease. And after that, it's an Indigenous American disease, then Latinos. It's a disease of darker people, essentially, because when you look at the numbers, we die at a higher rate. So when people were thinking, oh, we can't get this, that sort of leads you to make actions that would not protect you, like not wearing a mask, not keeping socially distant. And it's just been devastating. So that misinformation leads to death, and it continues to do so.
Great. Professor Harris, age in replacing race, seemed that came out at the same time. How has that impacted how students, particularly given that we're going back to college, back to elementary school, back to school, how has this information as it related to young people can get COVID affected?
It's definitely affected it. And I can say that with the young students who I work with and teach, that, they will wear masks because they know there's a pandemic, but there's a casual nature at times with socially distancing, with once you're around your group of friends, how you interact with your friends, because the thinking is, even if I do get it, I'll be okay. And so that misinformation that it's only killing our elders is really catastrophic, in that it can affect the smallest children. And piggyback on what Dr. Kimes is saying, when we look at the reporting that was done in the beginning, it was really on just the what, the numbers, the location, the charts, the graphs. And there hasn't been that look into the systemic racism that exists in this country that put us in positions where we have certain housing, transportation, food inequity that leads to these health disparities that then makes, when this pandemic hits, it makes it even more catastrophic for us. And that is something that impacts all ages, not just our elders.
So the PR spin was going wild in the White House. How did those spin doctors and what they described over time, Ms. Gogo, with each press conference confuse our population, communicate fake news or the truth?
I mean, it's just that, it was just confusing. And people didn't know what to believe. Most of my work that I do right now is focused on federal government health communications. That's what I do. My clients are CDC and NIH and FDA and those types of agencies. And historically and over time, they have been the ones who are always at the forefront and leading the conversations, and you can trust them. And, you know, as we turned out, some of the information you could trust, some you couldn't, some you had to scrutinize, some you had to over scrutinize. And the problem was at the very beginning, you know, it is a novel virus. It is brand new to us at this time. So there were things that were evolving and people were trying to understand what was going on. And the news was shifting based on what we were learning as it was going on. So it was also hard to follow in that regard. But, you know, there were some folks who were a little less truthful on a continuous and consistent basis, and people needed that information. People were dying for information. And so they turned to friends and family and colleagues and an old high school friend or old neighbor or things like that to get their news and their information. And, you know, it sort of just started spiraling a bit out of control, frankly.
Don't wear a mask. Do wear a mask. Don't wear a mask. Wash your hands. The messages, even now, are confusing.
They're confusing.
Based on health disparities, what is this causing to happen as it relates to people showing up in their timing and their relationship to health, Dr. Connors?
In terms of their timing and their relationship to health, you know, you're already behind the 8 ball. You know, if you're in an affluent area, people tend to do a lot of research. There's access to research. In less affluent areas, you may have less access to the computers and other things that could get the research. There were some studies that showed that wasn't as bad as we thought. But it all comes down to one thing. It's truth. You know, there's either truth or someone's telling you something to push a narrative. And it's so unfortunate. I still have faith in physicians. I think that we should all utilize our primary care doctors and whichever doctors you see, because we have an oath that we took, you know, the Hippocratic Oath. And beyond that, though, I don't think I've met a physician that would let a patient die. You know, I think we all are inherently, whatever our mood is, whatever the race, whatever the age of the patient, we're going to get in there and do everything we can. I'm board certified in emergency physician, emergency medicine, family medicine, addiction medicine, and pain. And I think that the most appropriate specialty where I saw this was in emergency medicine. When people come in and sometimes you have seconds to figure out what is going on, whether they're able to talk to you or not. And we all gave our best, you know, and I think most physicians will do that. So use your resources. But, you know, there's probably many of us in the less affluent areas that don't have a primary care physician. Preventative medicine or preventive medicine is something that we really don't take note of. So when people find out they have diseases, it might be late, like prostate cancer, lung cancer, those things. So, you know, it all comes down to truth. Use your resources. Be willing to just have a hunger for knowledge. And if you're not, ask people that you trust. I know my patients trust me. I had a patient a couple of weeks ago about to get surgery. She refused to have surgery until her doctor spoke to me. It almost brought me to tears because I was like, I know you trust me, but when a doctor tells you you need surgery, get the surgery. But I did speak to the physician, and we made it happen. So just comes down to that, you know.
You know, speaking of that, what role has media played in the distrust that exists, Professor Harris, as it relates to um, the medical industry, healthcare, period? So where is this stemming from, and how has the media played to exacerbate this whole experience?
Well, we can say that COVID isn't the start of this distrust. And for many of us, it was the Tuskegee experiment where that has become the central story of distrust among our community. But we can go back well before Tuskegee and well after Tuskegee in the ways that our bodies have been used for medical experimentation to help the industry. And Dr. Deidre Cooper Owens, she's a friend of mine and an academic that writes on our bodies and the contributions we've made unwillingly to the medical industry. So there is a distrust with respect to going to the doctor, also access. But when it comes to the stories, we're hearing about the stories of these medical malpractices well after it's said and done. And so there's a distrust right now in, I'm not going to get a COVID test because what are they going to put in my nose when I get that test? And so we have our community that is thinking about this history of what has taken place with us. And now, and that's visiting it even in ways where we think it's a preventative measure or a way to help save people by understanding and isolating whether or not you have COVID. That alone, we're not able to get past for a number of ways. And with the media, I think the way we have to look at it as focusing on journalism, those truth-telling stories, and also look at more context, bring context into those stories, not just reporting data and numbers, but really bringing stories of us into them.
You know, who's going to write those stories? We'll have to figure that out when we come back. You'll tell me who's writing those stories.
Okay.
The press releases, the speeches that have been given, and then all of a sudden, our dear brethren goes to the Republican roundup, and then 9-10 days later, he's deceased. How do you spin that? And why are they continuing to spin that, Ms. Gogo? Because there doesn't seem to be a lot of truth in that. And they had brothers and sisters parting, and then our dear brother Herman Cain passed.
Absolutely.
You know, I think that some people believe what they want to believe. And, you know, they already have a layer of, I want to believe this, because otherwise then everything else behind was a lie. So I have to keep going with this. I have to keep going along this path. And so I think some people want to believe it to be true, and will continue on that path, because otherwise everything else they thought they knew and had purported to be true, told their friends and told their family and everything, actually wasn't true. So to backstep all of that, you know, is a difficult process. But I think, you know, as Professor Harris said, it's the truth tellers. People have to be out there and be willing to stand in the truth and tell the truth about what's going on, and to be able to really look at these reputable sources. There's some things that you just, you know, A plus B plus C, you know, you have to look at them as they go along and see how they connect.
But I'm very concerned because I know enough Black physicians, from Dr. Kimes to obviously Dr. Heavenly, Dr. Jackie, all just great people who are social. And, you know, I have to check people all the time. I'm like, slow down, homie. They're not reality stars. Like, if I got sick, I know that he would save me. You can't save me. So don't say he's a reality star. You know, you like start with the MD and then go backwards. No, don't even like approach it like that. And I'm really concerned that we have allowed people who aren't doctors to tell us what to do. How are social influencers responsible for some of the fake news that's going on now, even in their behavior, as they showcase what they're doing during this particular moment? Dr. Kimes?
I think they're extremely responsible because you've always got to ask yourself, and those of you that are journalists or have done journalism work, I think you have to ask yourself before you post something or publish something, you've got to ask yourself, is this really true? Have I made sure? And that's among physicians too. Sometimes we put out data that from studies we've done, we spent months on it, we stayed up late at night working on it, and we forgot that maybe some of the statistical mathematics that go with it are just off. And so what we're saying is not true, as we saw with the FDA recently when they put out some statements. It just, the math wasn't right. But I guess the thing is, we have to do the same. So just so people know what we need to do, okay? With some of the news media or more conservative news media that's out there, one of the good things that they do is they repeat things. So we need to do the same thing. We need to repeat that masks are necessary, washing hands are necessary. And we also need to say things like, if you and I have a mask on, there's a less than 5% chance that you're going to get COVID, even if one of us has it. You're just not going to get it because your respiratory particles are going to get caught in that mask. We now saw some data that came out this week that said that COVID is actually aerosolized. All that means is it's even smaller particles that can go even further. So now this whole thing about 27 feet, if you cross, cough or sneeze, we're seeing all of that stuff is real. So there shouldn't be a political statement. And I guess, people are driven by what they believe. So they may put out information and say, well, I'm going to put the information in this article out because I know it skews people towards the political or whatever motive I have. But the truth is the truth. In order for you not to get this disease, you've got to wear a mask. That is, in my opinion, the most, well, other than social distancing, because if you're hundreds of miles from somebody, or if you're talking on the phone to one, you're not going to get COVID from that person. But if you're going out and you got to go out, wear a mask. It's not that bad because, especially if you're Black, you almost have a 50% chance of dying if you get it. I mean, 40%, that's pretty scary. So my thing is, we need to repeat positive information and truthful information and keep on saying it, because that's what the other party's doing. They'll get up there and this isn't Democrat or Republican. It's either liars or truth tellers. And it seems like the liars like to tell their story over and over. We truth tellers that make our living off of telling people the truth, keep on going out there. That's why we were at the March on Washington this past weekend. That's why I'm on this outlet today. And if someone calls me later on and says, hey, there's another thing I need you to speak at, I'm going to do it, because we're going to tell the truth until people understand that that's what we're about. We don't want people to die. And honestly, I don't want anyone to die, any race, any, political belief system, whatever. I don't want anyone to die because especially if something like this that came out of nowhere and changed our entire world. We need to fight back. And the way to fight back is with truth and honesty.
Professor Harris, you probably know a few influencers like Kanye West, and just to watch the exchange between Kanye West and Nick Cannon, Nomads, how does that impact an entire generation who is watching and observing individuals with no mask?
Oh, it affects everybody. And so when people rely on social media or entertainers to give them cues of how to operate in a pandemic, it's very scary and dangerous. And thinking about influencers typically are driven by bottom line, by money. And so they're promoting a message that helps meet their bottom line, or are sponsored in ways that support a product that may not be something that we need. And so it's really important to be able to go to trusted sources, to science, to data that helps with understanding what that truth is, what we're all talking about here, to be able to get those cues or guidance or comfort or even empowerment from those sources that keep us safe.
The commander-in-chief says, drink bleach, take malaria pills, and then says he's not going to wear a mask still not wearing a mask. This Gogo, how did that affect the country and the media's perception of this virus?
I think sending messages at the highest levels of our government that on face value are dangerous to everybody, to those who thought that it was going to be okay to drink bleach, when I think all of us at some level know that that's not okay, that's not something we were ever thought was going to be okay. I mean, you learn that from little toddlerhood. I have a 3-year-old. She knows things that she's not supposed to touch. That's why they're up high, And so I think that having those kind of messages out there are dangerous. They're dangerous to people who follow them lockstep, just whatever somebody says, they're going to follow it. And I think it does make it more important for individuals to really do their own research. Dr. Kimes said, check if it's been reported 3 or more times by another source. If somebody else said, if 3 other people said the same thing, then, start to pay some truth to it. But I think one of the biggest things is just that there are those who want ratings, those who want followers, those who want viewers, tweets, retweets, likes, shares. People want that. That is, as Professor Harris said, that's their currency, and that will get people killed. People will die by relying on somebody else who has an ulterior motive. And at the end of the day, it's up to you as an individual, as someone who cares about yourself, your family, and your households, to really make sure that you are looking at the information very closely. And sometimes speed is not your friend. Don't be the first to share something else, check it out, really look at it. If it's amazing information and if it is life-saving information, it will be in 10 more minutes. So do your research and really check and make sure that it's actually true. You don't have to immediately just hit send, immediately hit share, like, oh, girl, look, I saw this. Oh, look, I saw this. Take 10 minutes. Take 10 minutes. If something seems that sensational, take 10 minutes.
Are the social media platform owners responsible? How should they be protecting our community? Professor Harris?
We could say they should be, but they're not. And they can claim to be, but they're not. If you go onto social media and there's an algorithm that may detect that when you're posting information about COVID, there's this pop-up that makes you think, is this really true and should I share it? And somebody whose intent is to spread rumor or conspiracy theory, they're going to just bypass that pop-up or exit out and share what they want to. So we have to consider our sources and what accounts are posting information that we're reading, and understanding what they are, because not everything on the social media channels is truth and fact. And a lot of it is entertainment, and it's also what could be the conspiracy theory and the rumors that's put out there to provide misinformation.
How about you, Dr. Kimes? What role do the owners play in protecting us?
I think the owners of the social media platforms play an important role, the same role that we play as influencers. We have a duty to people. We've got a duty to tell people the truth, because a misstep in information can cost lives. Like going back to the bleach thing, people died. People ingested bleach and they died. And as an emergency physician, you've got to take in a good amount of bleach to actually pass away, or either it needs to go into the lungs, you aspirate or something like that, something that's going to cause immediate damage. But it happened, people believe the president and they did it. And it's so unfortunate, because that's another death that didn't have to happen. So I do think that they need to police the social media platforms. I think the owners need to be very, very honest, because you have a responsibility. Like, I'm extremely careful about what I say, because I know someone can hear something and if I'm wrong, it can cost them a life. Like our One of the things that physicians do, it kind of sets us apart, is we're constantly searching for knowledge, and we're very competitive too. So if your colleague tells you, well, hey, I read in the New England Journal of Medicine that this and this happened, you're like, dang, I got to go home tonight and I'm going to have to read too. Be competitive about information. Be competitive about life. Because like I said, we make up 13% of the US, but we make up almost 100% of the culture of the US. You know, people follow what we do. I think African-American, African people, Black people, whatever you want to call it, we lead the way. Look at any country you want to look at, and someone has borrowed our culture. I think it's just beautiful. God has given us all gifts, and we just seem to lead the way in trends, in the way we speak. I mean, even certain words, mood, vibe, these are things that little out of my age range, but I know what they mean because we're influencers. So we have a responsibility, you know, and, you know, I'm decades old. I'm not going to say now because I've gotten to that tender age where you don't want to say how old you are anymore. But the thing I've learned in life is, as much as I've thought that the world is just full of good people like me, and we really are trying to do our best, there's some folks out there that do not have your best interests at heart. And so when you're looking at something, even if it sounds good and you really thought about it, just really do some background on it. If you hear something I say, do background on it. I'm humble. If I'm wrong with something, I'll take that information to heart and trust I won't forget it again.
You know, Ms. Gogo, it seems as though there's not enough press releases. If you were writing a press release right now for Joe Biden to be able to share about healthcare disparities and the role that he and the community needs to share and change right now, what would the first few sentences of that speech be?
Wow. That's a lofty job you just put on my shoulders.
Only a couple sentences for a true consummate PR professional. You know, you've been in crisis communication. Don't play with me. I understand that.
No, I mean, I honestly think, I think it goes back to what Dr. Kimes just said, you know, take heart and just check everything. We are a small percentage of this country, and we are disproportionately affected by so many diseases, not just COVID. I mean, this is the biggest and latest one, but there are so many, you know, and there are things that you as a individual, as a, you know, a citizen of this United States are able to do on your own. And so really take ownership of your health. Take ownership of yourself. There is only one person can do that, and that is you. So there are things that I know sometimes we want the government to be able to provide directly for us all the times. There are things that we can do ourselves, but it's really take ownership. And if that means asking questions, asking a lot of questions, asking more questions, asking, you know, of people that you trust and people that you know, and sources that you respect, but really taking ownership of your health. And you just can't believe everything you read or see or heard or was shared, but really take ownership of it.
You know, it seems that it's not as clear, and I was getting to this before, when you think about the faces of the pundits, the Black or lack of Black doctors that are on screen, that are carrying the message. It was amazing that there was a channel, and one of my favorite guys obviously is Van Jones, and they're having a whole conversation about COVID, but it was kind of absent of Dr. Kimes and many of the other Black physicians, and the position of the absence of Black physicians in the media speaking to their community. Professor Harris, what's the impact of that?
Oh, that's huge. In that, when we look at broadcast journalism, as an audience, we are looking at faces that look like ours and establish that trust with faces that look like ours. And so when broadcast outlets go to their commentators and the people, they typically are the same ones. They rely on the same people. And there is a glass ceiling in that it's very difficult when there is a face that looks like ours. It's going to be someone that we're really familiar with and isn't going to be the hardworking, lesser known expert. And so we have to look at other models sometimes because there's power in the visual. The broadcast does present all images for us. And so can we look at other ways of getting information through the written source where we can envision and visualize what's being said in our own mind without having images put in front of us. And so extending into other types of forms of journalism and accessing information can then help us so that we're not relying and dependent on the images that are being put in front of us.
I'm not sure. I am thinking that we need to make bigger demands. I think that it's a moment in time for us to even demand that, you know, like Sanjay Gupta, but I'm talking about you, Dr. Kimes. I like Sanjay Gupta, but I want to see Dr. Kimes on there sometimes. We're right in Atlanta. I think it's insulting that Black doctors are really not speaking to it. I mean, Don Lemon's cool, but I really don't want him to keep interviewing everybody. And I think when he doesn't reach back into Atlanta, where there are over 2,000 Black doctors, and put them on his platform, then it's not, you know, it's disingenuous to me. What do you think about that, Dr. Kimes?
Well, I have a saying that's at the end of all of my emails. It says, your success is inevitable, and with it, you will change the world. So no one can stop me, you know, from talking, and it's only a matter of time. I'm looking at things that have happened this year alone. You know, I was watching the news one morning, and I admired Attorney Ben Crump for what he was saying with Jacob Blake, and lo and behold, that same night, I was sitting at the dinner table with them. Your success is inevitable. When God has something for you, it is for you. So it's only a matter of time before either I'm on a news media outlet speaking truth or someone else. One way or the other, it's going to happen. And that's what's happened with us as Black people in general. It's only but so long people can hold us back. When you're telling the truth and something's meant for you, no one can stop you. And I hope everyone out there listening to this will first forgive me for my technical misstep there. I don't know what happened.
No, that's COVID. That's COVID. You can blame everything on COVID, bro. I mean, everything. Plus, you're at your family's house, so you know it's no big deal here rolling out. So it's not a big deal. That's the least of our concerns because you're a true professional.
Well, the thing is, I'm just going to keep pushing, and like I said, it's inevitable. It's going to happen because the other thing is you can speak things into existence. You know, we have power with the words we have, and I don't mean to sound too preachy, but I think that's the truth too. So God made us in his image. So when we speak things, they have power. When we do things, they have power. So just keep speaking. Eventually, you're going to have to be heard.
Well, those are places that we definitely, for anybody watching, disagree. Dr. Kimes, we need to let everybody know that Dr. Kimes needs to be on CNN. Black physicians need to be on CNN. We should tweet it. We should demand it. We want to see more Black doctors on these channels, you know, and him hanging out with Van and you and Van doing testing together across this country. And we don't want them to stop with COVID. We want to eliminate some of these health disparities. Let's go.
If I can add one thing, Munson, on
only
that.
one.
Yeah, just one. You know, I think it's a bigger issue. It's a bigger systemic issue across all of media. You know, as I said, I started out in newspapers many years ago, and you know, I was a Black sports writer. There were very few Black women sports writers. There are still very few Black women sports writers. It's just things that people need to look at. And I hope even out of this pandemic that we will look at some folks who are in schools and in colleges and looking at what kind of careers they want and looking at trying to help to address these health disparities, and that Black folks will pursue these careers and that others will pursue the other side of it and working in media and working in newsrooms so that they can sit up and say, this isn't right. We need to have those Black doctors on TV. So it takes it from both sides. And I think breaking some of those ceilings that Professor Harris spoke about and getting into some of these positions where they can make differences, I think is very key. And this could be a turning point, I think, as we look at diversity and inclusion and equity across all of these different employment sectors.
So you're agreeing with me on the
I
big
agree
picture.
with you.
I'm
agree
trying,
with you,
I'm sharing with
100%.
my brother. He's gonna do his part, but I'm gonna do
Absolutely. I
my
agree
part to
with
make
you.
sure we understand that 63 to 69% of the entire sports journalism career path, 32 teams in the NFL, and about 82% of all the executive jobs are going to individuals who are not Black or brown.
Exactly.
Those disparities in media are atrocious. And they impact how all of these individuals, and my issue is these are not $10 an hour jobs. These aren't $15 an hour jobs. So the disparity is so horrible because it robs us of millions of economic dollars for our own Black economy. Mm-hmm. And the careers and the opportunities and the newsreels that you're not able to share to get the next job, or even as you were sharing, you can't cover a show that you can cover a Super Bowl or get that next brother that's like, oh yeah, I want to talk to the brother. How is this impacting our community, the absence of actual media makers, journalists, Professor Harris?
There is an impact, and I'm looking at it from the lens of teaching young scholars at Morehouse. And with that, we have Spelman and Clark Atlanta as well. And so at Morehouse, we have a program that was created for journalism and sports. Spike Lee seeded the money to start that program. Ron Thomas is the director, a notable award-winning sports journalist. And so when I look at it through the eyes of the scholars in our program, there is a future. There is a way that they today are covering stories on protests, on COVID. They're not waiting to get that job at the New York Times. They're covering and putting their content out there. And because we have different platforms that exist today, we don't have to wait on the New York Times for that hire right now coming out of school or while you are in school. So I'm hopeful in that, who I work with every day, the 50 students who are in my classes and advising, they are doing the work and they are getting into those spaces. And so from their generation, they're seeing that their messages, they're represented, they're engaged, and they have a very positive outlook. Where I worked in the industry, being the only Black woman covering the Hawks games and sporting events, that can be something where you say, where's the future in this? And so I see a future. I see that as we look at broadening where we find our news is really important. We don't tune into just that one channel at 5 o'clock at night. We need to be able to look at all the forms of media that's being put out there in healthy ways.
No, that is not the case. That is not what we're getting ready to do. You are so sweet and nice and kind, but we have to demand that these newsrooms and the math, the percentage of individuals, we can't wait, because what happens is you're trained, you're there at Morehouse, and then it just hits you when you don't get that job and you're more qualified and you've been running a blog. I think we really have to use this moment to understand this is an uprising, and we have to set some expectations and demands, because NFL has said, oh, we with you, but if that's the case, then let's send them a note from Morehouse. Let Spike send a note and say, hey, you know what? Every team, let's make sure, let's ask the brother that's gone over to the Redskins, how many young Black journalists, and how are you brother that got the first, how many are you bringing with you in the door? Because if you didn't demand somebody come in the door, then, that's the special Negro principle. You're the one. We've got enough of the ones. And I think that this is that moment, particularly in media. And I think it's even the high paying jobs, because see, it's the jobs and the money and the experience. When you think about sports journalists, they're getting paid, they're covering it, and then they're not letting Black women in? Come on.
Well, if you look at Erin Haynes-Wack, she was with the Associated Press in Atlanta and then went to Philadelphia. She just started her own news platform. It's a nonpartisan news room run by women, and she is in charge. And so I look at Erin and what she's created and what she does in the industry in making your path. So she's worked in those traditional spaces that many people want those jobs, but that's not enough, because sometimes that voice, your voice, may not want to be heard in those spaces. So we have people that are starting their own and doing really good things.
And I love that. And I'm still going to make a demand, because at the same time, as an entrepreneur, you start out, when they start out, they get funded. And you're thinking about media. When I sit back and I hear Dr. Kimes in the trenches, and he's literally risking his life, because that's frontline work. That ain't backline work. That's frontline work. And yet they're not offering him a special. And I can see guys making money off the special, increasing their real, and obviously, Professor Harris, I know you're doing the best, but we've got to remember that Disney wrote off $500 million on Vice Media. They wrote it off. 500 million written off. What would that do for scholarships at, just pick 50 HBCUs, 10 million each just in media? I think when I say demands, I just want us to pay attention to the money. I think one of the things about media is, one, I'm not certain we're clear that we're picking cotton as it relates to some social media. That we are literally providing free content, and you're hoping that you can sell your influence in a secondary market, but your primary work must be free. That sounds like indentured servitude to me, but I demur, I think it's a concern of mine. We've got 15 minutes, and I'd just like you to go out. What impact is media having on COVID and removing health disparities moving forward for our community? And I'll start with Miss Gogo.
Yeah, I mean, the word removing has thrown me off there, because I think addressing maybe a little better, but removing health disparities, I mean, there are systems in place that continue to keep Black and brown folks down. There are systems that are in place that have been longstanding, and so saying that that media can remove them, I'm just not sure that it's a media thing to remove. I think they can shine lights on them for sure, and I think definitely heightening the conversation and elevating the conversations to the highest levels, I think is definitely the case. I think there are people who are using this time to really becoming more informed and being able to really see and hopefully looking at these numbers, looking at the numbers that Dr. Kimes presented of, we're 13% of the population. You have a sort of a 40-50% chance of dying if you get COVID. If you are Black or brown, there are things there that are in place that are keeping us at lower levels health-wise. And all of those things are systemic. Those are things to be addressed beyond media. But I do think that having those conversations at those highest levels within media, within newsrooms, beyond the newsrooms, in the board offices, are things that can continue to take place. And I do think that is important conversations to be had.
I'm gonna let you write all my speeches.
I'm ready.
I love it. Professor Harris.
Well, where we are right now, people want to have this sense of control. And with that information, the right information can help you gain that sense of control. Sorry, my light went out. And so what's really key, though, is we're talking about with news and information, we may not have newsrooms that reflect our population. And so what's crucial is the information that we receive, that we get, or that we demand, that it provides the context, and it is something that addresses the root. It's not just the what is taking place, but why is this taking place? And being able to lead that to us in spaces of empowerment. That's what's ideal.
All right. I appreciate that. Dr. Kimes?
Well, I think that I tend to kind of see things in a more positive view, but I'll say this: our young people are doing something amazing. You know, the Black Lives Matter movement, especially in intensity about 3 weeks ago, was world changing. That has never happened before like that. I think the our sports stars saying, "Hey, we're not going to play a game." I know there was some attempts to spin that like, "Oh, well, they can just afford to do it," and that's what. No, from Colin Kaepernick on, and even before Arthur Ashe and other people, you know, we've always stood up. But what I think now it's happening now is there's more movement. So I really see a positive movement here. I think people are doing things that you can't quell. So to our young people, I say, keep on doing what you're doing. I am impressed. I'm proud of you guys because you're out there in the trenches doing things in a way that we haven't before. But I want to, for the nerds out there, because I'm one of them. I don't know if I look like one, but I am one. For the nerds out there, remember, there's more ways of protesting. Activism doesn't have to be with your fists and hands all the time. It can be with right here, your mind. Because when you're sharp, people have a really hard time holding you back because the more you specialize, what happens is there's less and less people that can do the job you're doing. So someone has to bring you in because you're the only person who can do it. So use your activism in protesting by doing well in school, by being the decision maker. Because at the end of the day, um, you know, folks like Keisha Lance Bottoms and other people that are in leadership, they can make decisions and things can happen. And that's incredibly impressive. And I think we need to, for the brothers out there and for even the people that are not Black, because there has to be something to be said about those folks too, because they're out there. We have white brothers and Hispanic brothers and Asian brothers and sisters out there that are out there hand in hand with us in these protests. We need to fight this is every way we can. And we need to dispel some of these myths. So if someone Black or someone brown gets in a position of power, does that mean that everyone else is doomed? No, we are people. One of at the march, one of the things that we said, and hopefully they'll show this, was, you know, there is no them. There's only us. There is no them. There's only us. We are people. We just happen to look different. And once we start seeing that, there'll be less and less division, and we can accomplish things that needed to be accomplished for a long time.
Dr. Harris, you were writing some long notes. So
And you want me to respond to?
Kenny Smith walking off. He literally walked off during that moment. What did that say as it related to media for him and for those journalists that were in that position or in positions about even what they can do?
Well, with him walking off, it says that he cares. He's a human being who cares. And oftentimes when we get into positions of power and influence, you know, it could be said that you forget your own, you forget your community, or you're operating from a white male patriarchal lens that doesn't allow you to actually be yourself. And so for us to have moments where we see commentators being who they are or expressing some emotion, that can be a good thing. And it ripples not just to the audience, but it ripples down to other people who are looking to have positions like that, to see that you don't have to, you know, dress the part, speak the part, and do the part, but you actually can be put a little of yourself into what your work is and what's taking place in the world and being able to respond to that.
Great. Yeah, I thought there was a lot of skin in the game at that moment. And I think people love the connection and solidarity that seems to be there. Well, I want to thank you all for coming. I want to thank ARP for empowering this. Ms. Gogo, Professor Harris, and Dr. Kimes did a phenomenal job as it relates to media and COVID. I want to thank you for coming on Health IQ here on Rolling Out. So for everybody out there, if you didn't get it, listen to it again. If you're not following, definitely follow Ms. Gogo, Professor Harris, and Dr. Kimes. But take care of yourself. Thank you so much for everything that you've given to our audience, to those to increase their health IQ. I'm Munson Steve. This is Rolling Out on Health IQ. We'll see you again next Tuesday.